Good afternoon, everybody. First of all, I'd like to thank Steva for inviting me to this webinar. It's a real pleasure to me to be able to share with you what we have learned on pig salmonellosis from our studies on piglets here in Spain. What I'm going to show you in this time now is a study on the prevalence of Salmonella in piglets. But before that, I will make a brief introduction on salmonellosis in the pig production chain. I will explain why we decided to study this infection in piglets and why we are in a very good position to do this type of studies here in Spain. And I will show you the results of these studies and the interpretation that we have from the results and the likely conclusions that we can get from these results. So let me start with something that everybody, I think, know very well. That is just those baseline studies that were performed some years ago by the EFSA that were published, I think, in 2008, 2009, or so. And the first study was on the slaughtered pigs, and they found that around 10% of the pigs were infected, pigs that went to slaughter. This prevalence was a little bit higher in many other countries, and especially in Spain, with almost 30% of the piglets infected when they arrived to the slaughter. Then they performed some other studies on breeding and production farms. In this case, they were taking samples from, pool fecal samples from pens, from different pens in the farms, in breeding and production farms, and they found that at least 30% or around 30% of the farms were positive to Salmonella. This is, let's say, the starting point. I don't think these things have changed very much since then, at least in Spain. But most of the control programs that have been established in other countries in Europe, in general, have failed, or at least they didn't get the results they expect from them. So the situation, I think, is very similar. If we look at the pig production change from the very beginning of the south to the slaughter, we identify the different stages of this pig production change, and we make, probably most of you know of lots of risk factors that are associated with the presence of Salmonella. I'm not going to talk about all these factors, but we can group them in maybe 4 or 5 major groups. Some of the factors will be related to the stress. We know that the stress is increasing the susceptibility of animals to infection and also make those animals more prone for shedding. And these factors can be found all over the production chain. We have some factors associated with the cleaning and disinfection, with the overall hygiene of the farms or the premises. And again, those factors that contribute to the contamination of the farms can be found in any of the stages of the pig production chain. Another group of factors could be a group within what we call biosecurity, and particularly external biosecurity. So those factors that help to introduce the infection or the Salmonella into the farms. Let's say wild birds, rodents, farm personnel, or vehicles and things like that. Again, those factors are present in virtually all the stages of the pig production chain. And we also may think on feeding factors. We know that pelleted feed seems to be more associated with Salmonella, and wet feeding or fermented feeding go against the infection or against the colonization of Salmonella in the cats. Of course, those factors are associated with those stages in which we have animals to feed. And I will add factors associated with immunity, with the immunological status of the animals, the gut physiology of the animals, and those are especially reflected in 2 early stages of the pig production chain, in lactation and nursery. All of these factors, or most of these factors, have been studied very thoroughly especially on the unit, and the growing and fattening unit, at the slaughter, or even at the show level. But there is few information. There is not many studies on what happened on lactation piglets or the nursery, because the difficulty of studying this infection at this age. So that was the purpose of this presentation, is giving you a picture of what is happening at these stages. If we think on the results of this baseline survey, in which 30% of the breeding and production farms are considered positive, I will say this is more than 30%, just because bacteriology lacks sensitivity when performed on fecal samples. So probably we are talking about 40 or maybe 50% of the, on average, breeding and production farms that are positive. If we think about that, we think about sows that are infected, and if those are infected, what happened with these piglets that are born from them? And if those pigs are infected, what is the role of these pigs on further stages? And those piglets that are intended for gills or replacement in other farms, or for those pigs that are intended for fattening and go to slaughter. And especially this is important because we know that soon most of the antimicrobials that are used as preventative in the control of enteric infections at weaning or post-weaning are going to be banned. So what will be the consequence of this, right? So it's important to know what is happening in this period of time. If we look at the literature, if we make a search through the literature, we found that there is not many studies at these stages on Salmonella. And most of them are showing very low prevalences, between 0 and 9%. And if we think about that, we may think that the reason for that is because the presence of maternal antibodies that they say last for 8 or maybe 10 weeks. But thinking a little bit more on this, or looking at these studies in depth, we realize that most of them are based on collecting rectal swabs. And we know that the swabs are giving you a small amount of fecal sample that to be analyzed, right? And we know that the amount of feces that we analyze is related to the probability of the detection of Salmonella. So at some point, we can think that we may be underestimating the real prevalence of infection for these pigs. So the main objective of this study was, our objective was to study Salmonella in weaned piglets from breeding farms. I will explain now why we use breeding farms. And we have a very good opportunity for that because, as everybody knows, Spain is different. It's different in many things, but it's different in one special thing for us, and is that we love roasted piglets. And if we love this kind of meat, that means that we have slaughterhouses that are intended for the slaughter of this kind of young pigs. So we have a very good opportunity of having information on having the samples required to make a good assessment of the infection in piglets. So our objective was to assess the prevalence of Salmonella infection in piglets from Salmonella positive breeding farms. We use breeding farms because they have one characteristic in common. These farms raise the female piglets for replacement animals, for gills, while the male piglets are sent for slaughter. So we have a very nice sample of animals that go to slaughter at a very young age and that are free of antibiotics. So we tested these farms. They were seropositive based on high levels of serology. More than 50% of the samples we analyzed were positive. So we were pretty sure that Salmonella was circulating in those farms. So the type of sample we got from those farms were the following. We have those farms, they wean the animals at 4 weeks old. So if they reach 7 kilograms at that age, they are sent to the slaughter. If they don't get that weight at 4 weeks old, they are rising some sort of a nursery for 2 additional weeks. And when they are reach these 7 kilograms or more, they are sent to a slaughter. At the slaughter, we were able to get this intestinal package from which we can get intestinal content, lymph nodes, mesenteric lymph nodes, and meat juice from a diaphragm muscle that was attached to this intestinal package. In addition to those samples along the period of collection of samples from piglets, we got samples from weaned sows, which were not the mothers of the piglet, were contemporary sows that were in the farm at the same time that we collected the samples from piglets. So we got some fecal samples from individual animals. We got fecal samples, pooled fecal samples from gill units from the pens, and we got also blood samples from either gills and sows every 3-4 months, and at the same time that the samples were collected for the Ojeski's disease program. The fecal samples and the mesenteric lymph node were analyzed with the ISO standard for bacteriology for detection of Salmonella. Serology was performed with an indirect ELISA for blood samples and meat juice, and then after that we serotype all the isolates we got from piglets and sows and gills, and we also make some molecular typing to find potential genetic relationship between isolates. So let's go to the results, and you will see that regarding weaned sows, well, in all the farms we found positive samples from these sows. Just in one farm we got just 1 sample, but most of the time we got around 20 something positive samples, percentage of samples positive. Regarding serology, as you can see from in this chart, most of the sows were serologically positive. On average, 72% of the animals were positive at that time. If we look at the gill units, you can see that the samples obtained from the pens from these units, we found around 27% of the samples positive. It was pretty similar. Well, some farms had more than that, but there was positive samples in all of them. And serology also gave us some idea of the circulation of Salmonella in that, because around 25% of the gills analyzed were seropositive to Salmonella. So we have Salmonella circulating in those farms, and we have Salmonella circulating in the gill units. When we look at the prevalence of infection and shedding in those piglets, we found a very high prevalence, 36%, virtually the same for shedding and for infection. With some variations among farms, but on average 36%. If we look at the prevalence by age, we virtually found also the same in 4-week-old piglets and 6-week-old piglets. So that means that, well, that makes sense. I mean, those animals that 4 weeks old are the same, well, I'm saying are those that are going to be 2 more weeks if they don't reach that weight that I told you before. The most interesting thing about these results was that among those infected piglets, more than 70% of them were shedding Salmonella. A less proportion, around less than 30%, we didn't find Salmonella in their feces, which doesn't mean that it wasn't there. It could also associate it with lack of sensitivity of bacteriology. But among the non-infected piglets, most of them were not shedding, and a small proportion was shedding. When we tried to understand why some of them were shedding, we realized that the amount of mesenteric lymph nodes in positive in infected piglets was higher than the amount that we could obtain in negative piglets. So it seems that, as I said before, the amount of samples that you analyze matters, and is likely a bias associated with a small amount of mesenteric lymph node to analyze in non-infected animals. So some of these, and probably many of these that were shedding, were also infected. But considering this data that we have here, we realize that the uninfected piglet had like more than 10 times the odds of shedding salmonella compared to a non-infected piglet, which is kind of important. We then look at what isolate the piglet was shedding and what isolate we found in the mesenteric lymph nodes, and we analyzed 40 piglets, and from the 40 piglets in 39 we found a clear genetic homology between what the strain we found, the isolate we found in intestinal content, and the strain or the isolate we found in mesenteric lymph nodes. So that those results indicated that these piglets were active shedders of salmonella, so they are contributing a lot to the contamination of the maternity. And when we look at serotypes we found in piglets and sows, we realized that 82% of the serotypes that were found in sows were also found in piglets. So the relation between sows and piglets seems quite right. And we then tried to determine that genetically, and we analyzed isolates from piglets 4 weeks old and from those isolates from sows. And we here found again that there was patterns, many patterns, in which we can find the same isolate in piglets and sows, right? So this was confirming that the sows has a role in the piglets infection. We went further and analyzed what happened with the gills, what happened with the isolates from gills and the relationship they may have with, in this case, with isolates from 6 weeks old piglets, because those were in the nursery. That is what happened with the gills. The gills had been in nursery first, so we wanted to check that for those pigs that had spent some time in the nursery. And we found again clusters of the same isolates, or very, very close, genetically close isolates in gill units and in piglets. So again, we found that there was a good relation between what we found in piglets and what is found later on in the pen gill, in the gill units, right? In the pens in the gill units. So there seems that there is a role of everything on what we are going to find further in further stages of the production chain. When we look at the ELISA values for those piglets, we found that on average around 20, the value of the other values was around 20. We don't know if this is high or low, because there is no information on what should be the level of antibodies or measured as optical densities in piglets. But what we, and one thing that is important to remember is that we use meat juice, and values of the values in meat juice usually is much lower than in serum. What we found very interesting was that the mean of the values for 4 weeks old piglets was significantly higher than the mean of the values for 6 weeks old piglets. That means that there is a significant drop in the amount of antibodies we can find after 4 weeks old. So I will discuss if the antibodies last for 8 or 10 weeks, as has been published before, at least the antibodies against salmonella. And another interesting thing that we found is that among 4 weeks old pigs, the value, the ELISA value for the non-infected piglets was much higher, significantly higher than the ELISA values for the infected piglets, which suggests that the maternal antibodies in those piglets were in some way preventing from the infection. Actually, we found a relationship that can be modeled, and we found that when the OD values were higher than 20, the probability of infection was significantly lower than when the values were were approached to zero or to very low values. So concluding, I will say that the prevalence of Salmonella infection and shedding in piglets was and probably is much higher than we expect from previous studies, that those piglets that are infected are actually active shedders of Salmonella, so that has to be taken into account when we try to control Salmonella, and that there is a clear relationship between sow infection to piglet infection to gill transmission or gill infection. So what happened in the sow can go further to the gills and probably to the fattening pig as well. So my question here is, are we underestimating the risk in this period? Because probably we are underestimating it. Other thing interesting is that we found that the antibodies, the other values which measure in some way the levels of antibodies against Salmonella was more than 20 in those 4 weeks old piglets, and that was related with less infection. But those values dropped significantly at 6 weeks of age. And then another question that arises from these results is, why are not finding clinical symptoms of salmonellosis in piglets during lactation? Are maternal antibodies protecting against clinical infection? It's possible that some of this diarrhea that we see during lactation are of Salmonella, but we are misdiagnosing them because we always find E. coli. Another question is what is going to happen in the nursery when the ban of zinc oxide and other antimicrobials is in place? Are we expecting more clinical outbreaks of Salmonella at this time? So my point is that if we want to control Salmonella, we have to put hurdles to Salmonella at each stage of the pig production chain. And we have to look now very carefully to the piglets, the role of the piglets, and therefore the role of the sows. We have some studies indicating that the vaccination may be one of the strategies to reduce colonization and shedding in sows, which according to these results may help to reduce infection in piglets. We know that there are strategies in the growing and fattening stage using organic acids or prebiotics or some essential oils or combination of things like that may help to reduce significantly shedding. And we are working now in a strategy on slaughter, including organic acids in water at the light edge, so the animals, when they wait for the slaughter, they can drink at least the water they drink are with organic acids. And we have seen a significant reduction of around 17–20% of shedding is reduction of shedding at the slaughter during that time of waiting for slaughter. So everybody together will make a carcass safer. So the final conclusion for me will be, we need to reduce the Salmonella shedding in sows. We need to increase biosecurity and hygiene, and we need to boost piglet maternal immunity. And there are some strategies out there now that can be used to attain these 3 objectives, and altogether it should be good to reduce the prevalence of piglet infection and weaning, and probably to further reduction of infection in other stages in the pig production. So just to finish, thanks to my students, Alejandro and Maria, for their help in working on this, the projects that funded these studies, and of course the companies and the people who have been working and helping us with these studies. Thank you everybody for your attention.